First, telling a patient that they have cancer is probably one of the hardest parts of my job. You can kind of see that overwhelmed look just settle in, and you know that they're really not comprehending or hearing the rest of what you're saying.
I think it's very important for them to understand that they're here now. We're here for them now, and this is the first step to find out what exactly is going on.
Walking that journey with the patients is just very rewarding. I see the strength that they have and see what they're like in the beginning and then how strong they are at the end.
My goal is to give the patient answers, start the initial process of cancer diagnosis and initial process of the evaluation.
Waiting for the results is scary. So that's where we help to move to the next step. Sometimes they go to surgery first. Sometimes they need to see the medical oncologist and/or a radiation oncologist.
The three types of treatments that we use for cancer are surgery, radiation, and chemotherapy.
Chemotherapy is usually given intravenous or through an IV. So the patient can get an IV in their vein, or patients get an infusion port. It goes under the skin. It's just a safer way to give chemotherapy. People say, oh, chemotherapy, but you don't feel chemotherapy when it goes in. It's just a regular IV. Some chemotherapy medications make you more nauseous than others, so we pre-medicate patients. We prepare for all of that ahead of time. It can be run for an hour, it could be 2 hours, it could be 3 hours, and then they go home. You know, we take it out, they don't stay overnight, it's an outpatient procedure. And like I said, it depends on what plan the doctor has on how often and things like that.
Some chemotherapies will cause hair loss and other chemotherapies won't.
So we do have the wig salon right here within our Oasis Spa. We encourage patients to go before their hair falls out so they can match it.
Now, surgery, on the other hand, typically is just going to treat that primary mass, tumor, whatever you want to call it. Radiation kind of helps clean up the area right around the tumor. So either we took it out, but the margin was close, or we're just a little nervous about whether we were able to get everything. So we'll give radiation to kind of zap anything that might be left behind.
When the patients come in, we usually have a team of people that they meet. We have our nurses, our radiation therapists, who are with them every step of the way to kind of guide them, to be with them.
So in radiation oncology, we have a gong, and it sits there, and it's in the hallway right where patients come in to change for treatment. So every day they get to look at that gong, and then they hear other patients ring it at the end of the treatment.
But the whole staff at the radiation department lines the hall. Everything stops when you graduate. And then they hand you that gong to be able to ring. That gong could have been heard through every floor in this hospital, I'm sure.
We are very proud of our patients when they finish. We are very happy to see them finish. And for us, it's a celebration just as it is for them.
It's just a symbol that you're done, and patients like that too. It's just kind of like puts it all together that they've gotten through this.
I think survivorship is a really important part of the cancer patient's journey. If we were having this discussion 5-10 years ago, we wouldn't be talking about survivorship, right? Because it wasn't something, we were just focused on getting patients through their treatment, getting them cancer-free, and that's wonderful. We did our job, great.
When they're completed their treatment, they get a survivorship care plan. It's just kind of a summary of everything they've had, their treatment, their diagnosis. We also tell them, what do you do now? When should you see your primary care doctor? How often do I see the doctors? So we break that down. We follow national guidelines. We also add some survivorship information and websites to that from some of the long-term side effects that they may experience. At that time, I really do encourage them to be part of the support group. They're still living with being a cancer survivor, and they had cancer, dealing with cancer, the fear of it coming back. And the support group gives them the opportunity to express that.
I may not be alive if I had to go anyplace else.
Because I'm still here.
I'm cancer-free.